I really appreciate the opportunity to talk today because, nothing's better than I can talk about the science, I can show the theories, and I can talk about it. But for somebody to live the science and see it themselves, I think is really, to me, impactful because I'm always about trying to improve people's health, especially as we're talking about a natural way. As you know, I deal daily with people in various situations and dealing with people at the end of life and a lot of, I think, horrific situations with their health, and especially now seeing more and more in their 40s and 50s suffering from health problems. Basically, what they've done to themselves, what they put in their mouths, what they do to themselves is leading to a lot of problems in our country. I had the opportunity this week of sitting down with the past president of the American Medical Association, and he's just saying our country is going to go bankrupt because we cannot afford to pay for the health care because of what we've done to ourselves. And he said the big emphasis now has got to be prevention. And when we talk about prevention, there's nothing better than what we're talking about today with you, is that we can have a product that can prevent diseases, can prevent your cholesterol from being high, can prevent the sequelae of having high cholesterol, which is that, heart attacks and strokes and all the problems that we see. If we can prevent that, then we're going to decrease the healthcare costs in our country. So what little we can do, what costs we can do right now in taking a product that can make some differences in our health are in the long run going to make a gigantic difference both in our own personal healthcare costs, but also in our country's healthcare costs. And so I was excited to see you live the science today and for and talk about your results about a product called KardiaXyme, which is basically an algae infusion. We're getting right back to those basic cells. We're taking a group of algae, fungi, and bacteria, and in the water that they live in, they've been extracting some chemicals, proteins, and other substances that have been extracted away from the algae and the fungi. And these particular chemicals together in this product, KardiaXyme, that people drink 2 ounces twice a day, have been given miraculous results. We've done it both on a molecular level, down at a genetic level, as well as in human trials to see what it could do to people's health. We know that cholesterol is a big problem, but as you and I know, that some people could have high cholesterols and their arteries are clean. We have other people that have low cholesterols and their arteries are full of plaque. And so there's more to the story than just knowing your total cholesterol. There's things, as Ron mentioned, that high cholesterol, that healthy cholesterol, the HDL cholesterol, that lousy cholesterol, the LDL cholesterol, are very important. In addition to that, something called the lipoproteins, which are proteins that sort of tell which way the cholesterol is to go to the liver so it could be excreted from our body. And if we have enough of the right kind of lipoproteins that pull it away from our body and into our liver and being excreted out through our system, we need more of those. And the type that, take the cholesterol from our liver back to the cells that deliver our arteries, we need less of that. And so we look at these called apolipoproteins. We look at that healthy cholesterol and that lousy cholesterol. So we take this product, KardiaXyme, an algae product, getting back to those one cells, nature's one cells of algae, and look at the results. And the results have been astounding from both the trials that have been done in the Petri dish and on animals as well as the human trials, giving us a result that showed a total cholesterol being lowered at least 32%, a decrease in that lousy cholesterol up to about 30%, and even a decrease in triglycerides, and also an increase in that healthy cholesterol in one trial that was done several years ago of 42%. So we're seeing these increases in good cholesterol, lowering of the bad cholesterol, and at the same time, we're seeing two other important things, and that's increases in these lipoproteins, the good lipoproteins, the good markers that keep that cholesterol away from our arteries. We're seeing a 400% increase in those particular markers, and at the same time, the bad ones are being reduced at the same rate. And so what we have is a combination of overall improving our cholesterol profile, decreasing that cholesterol, decreasing the way it attaches to our arteries, decreasing our chance of getting cardiovascular disease. And when we look at it, in addition, we found through these different studies using KardiaXyme that we're seeing a decrease in inflammation in our body. And as we proceed in the next several months and providing more information to you about the importance of KardiaXyme, we're seeing that this also deals something with inflammation in our body. Not the inflammation you and I are familiar with when we jog and run, but the silent inflammation that's in our body due to our high-fat diets, our high-sugar diet, and that combination is putting that cholesterol into our arteries, causing that hardening of the arteries, which leads to strokes and heart attacks. And so we found with KardiaXyme, not only are we seeing changes in lipid levels or cholesterol, seeing a decrease in inflammation in their body. And so when we look at the benefits of KardiaXyme, and when we brought this to Xooma, we were excited about it as a product that can make a difference in people's health. And that's what I'm looking for, is to improve people's health. I don't want you in my facilities. I want you to be healthy. We found that KardiaXyme has several benefits. One, it maintains healthy lipid levels and health and blood pressure ranges within normal range. We talked about it today with Ron. It maintains those. Even after a month or two with Ron on the product, we know that even after 6 weeks to 8 weeks, we're starting to see the changes. The studies that I mentioned today were done in 12 weeks, that we're seeing those changes of maintaining healthy lipid health and also getting blood within normal range. We also found that it maintained blood sugars and healthy weights within normal range. It helped promote a healthy immune response and decreasing inflammation in the body, which is very important. And so when we took overall, look at this algae infusion, this colorless, tasteless water that some people say, well, what's in that? I mean, it looks like water to me. Let me tell you, it's filled with the right substances, the right proteins, the right chemicals that are giving us these remarkable benefits of increasing that good cholesterol, lowering that lousy cholesterol, but also in addition to that, making those markers that help us transfer the cholesterol from our arteries to our liver and then out through our intestines. It's increasing those markers, and it's lowering the markers that seem to make it stick more in our arteries. And so that combination plus the decrease in inflammation is going to give us some healthy hearts, some healthy support in our bodies, and maintain our health at higher levels. And so that's what I'm excited about today, Ron, and hoping that everybody can join us in trying it and living the science themselves so that we can get these great results together. So as we join hands in partnership in the next several months and bringing out more information to you, I'm extremely happy because we're going to see some major results in many patients and many associates, like patients, I get used to that word, but many associates every day, and helping them make a difference in their lives. And that's what I'm excited about. So thanks for the opportunity of bringing this